Well, we are back. This is Egberto Willis with Politics Done Right. I'm here with Dr. Sanjeev K Sriram. Did I say it right this time?
Yep.
And he is the one and only podcaster of Dr. America. And by the way, I call him AKA Dr. America. How are you doing?
I'm great. How are you?
I am doing just fine. It's an honor to be with you, especially
thank you.
what you promote. Tell us a little bit about what you do.
Yeah, so by training, I'm a pediatrician,
Uh-huh.
and then I'm also a health justice activist. I host a podcast called Dr. America on the WEAC Radio Network, and people can get episodes of that podcast on iTunes or wherever they get their podcasts.
Right.
And I also do a lot of health activism with Social Security Works, Doctors for America, the National Physicians Alliance.
Oh, you work with them as well?
Yeah, I work
Great.
with
I
a whole
love
lot
that
of
group.
different organizations.
I've interviewed the president of that group several times on KPFT 90.1 FM.
Oh, very cool.
Yes,
very
excellent.
cool.
Yeah.
Yeah, and my latest effort is pushing for Medicare for all.
Excellent. I mean, that's what I want to talk to you about.
Yeah.
Tell me, look, why should every American be standing up and pushing every one of their representatives towards single-payer Medicare for all?
So the thing that I tell people, and I want my patients and their families to know, is that Medicare for all means peace of mind.
Right.
That in this country right now, over half this country is struggling to put together $400 for a family emergency. It could be for anything as much as like trying to get a plane ticket to go see someone who's in trouble. And when Americans are in such dire straits, the last thing that they need is for healthcare to be yet another struggle on top of everything else in their life. With Medicare for all, it means that you don't have to pick between, am I going to go broke when I go sick? Can I take care of my health? Can I take care of my wealth? We end those false choices, and you get to go to the doctor when you need one, regardless of what you look like, regardless of what you earn, regardless of where you live. You get your basic human right of health care.
But Dr. Sanjeev, excuse me, that is too damn expensive, my friend. How are we going to cover all these people?
I actually love that question, because to me the status quo is actually way too expensive, and we don't get any health for like the status quo that we have right now. And whenever somebody worries about how do we pay for it, first and foremost, we're going to stop paying for the most expensive drugs in the world. We're going to start getting Medicare to negotiate with Big Pharma to decrease those drug prices. That alone saves $400 billion.
A year.
A year. And then on top of that, we're going to repeal the GOP tax scam. It's about darn time that millionaires, billionaires, and Wall Street started paying for their fair share, because while they're enjoying the good life, we've got little kids putting up bake sales and lemonade stands to pay for their mama's chemotherapy. We've got people putting up GoFundMe pages so that they can get money for their partner's surgery. With Medicare for all, we end all of that.
I want before continuing, I want to give an economic answer. I have a lot of conservative listeners to this show as well, and I want to tell you what he just said. Some of you are going to say, "Wait a minute, that is free stuff, and those people worked for their monies." I want to give you an economic answer. Do remember that the wealth of the wealthy is the excess labor of the poor, the excess labor of the middle class. They didn't make it. The ones who produce it are the ones who did not garner the entire value of what they produce. So therefore, having an economy that tax the excess labor of others is what makes sense. It's not a giveaway. It's
Absolutely
ensuring
not.
that an economy works.
That's
Continue,
right.
my friend. I didn't want to interrupt you.
Oh, no, not at all. And I mean, one of the other elements of Medicare for all that we have to consider compared to the status quo is that with our current system, even if you have employer-sponsored health insurance, back in 1999, a family was paying $2,000 a year in premiums for their health insurance, and their employer was paying $6,000.
Right.
That was 1999. 2017, the family is paying $6,000 a year, and the employer is paying $18,000. Now, I bring up the year 1999 because that was the year I started medical school.
Right.
I can't tell you that since I started medical school that we're doing 3 times of a better job in healthcare. I am not 3 times a better doctor than I was back then.
It is the only business in which success, the amount you make is not based on your success.
Absolutely.
As an engineer, if I build a bridge that falls, if I build a piece of software that destroys, I am sued. And not only that, I'm jobless.
Right.
That is not the case for insurance companies who screw up. That is not the case necessarily for the converse. So let's understand what's going on here. Likewise, why are we profiting from the delivery of medical care? Why isn't it a right?
Oh, that's a great question. Why is it not a right? And when you look at who is actually suffering for American healthcare, we've got over half of the uninsured in this country are people of color.
Right.
And when you look at the uninsured, overwhelming majority of them are working, and when you look at the people who are not working, it's because they are disabled, they're children, they're students, they are taking care of other sick people.
Right.
So it's actually that you don't want them to work because you need them to do what they are doing out there.
Facts matter, and I know to some people it doesn't, that doesn't speak to them. Well, when it happens personally, it usually does. And I've had a whole lot of converts that became converts not because they had empathy, but because it happened to them.
Right. The number of times that a medical bill has shown up in a family's mailbox.
Right.
And before you know it, the mom and dad are having questions about, well, in order to take care of this medical bill, we might have to postpone our kids going to college.
Right.
Or we're going to have to figure out how to sell the house back to the bank again. And these are all false choices. Why should we be undermining our family's basic financial health in order to take care of their physical health?
Let me tell you, Dr. Sriram, let me tell you what you're doing, first of all, is imperative. It's important work, your podcast, to ensure that people are educated on this, because a lot of folks are trying to talk to the politicians to tell them, hey, we need to give our citizenry that thing. I think it's more important what you're doing, and that is to tell the citizens you have got to demand that in other words, it's not just for the activists to tell the politicians that we must have Medicare for all. It is for the masses to tell the politicians we will have no less.
Absolutely. And as much as I want to see the political revolution in healthcare, I also want to see the cultural revolution.
Yes.
Where I want to stop talking about are people deserving or undeserving of healthcare. That is a completely un-American question. Of who is deserving and who is undeserving of healthcare. Because when you're the one who gets sick, all of a sudden you became a deserving person.
Exactly.
And I feel that, well, since all of us go by the grace of God, then are we not all deserving of this?
Absolutely so.
And so that is actually, to me, a cultural revolution that can happen around our kitchen tables, in our backyards at barbecues. It can happen at Thanksgiving dinners. I want people to have these conversations with each other, and then, yes, absolutely take those conversations to the halls of Congress.
You are definitely one of the teeth in those gears to get that job done. And having folks like yourself, a doctor who has the experience to do that, will get the job done. Keep up with the podcast. Tell folks a little bit about your podcast again before we close out here.
Sure. So the name of the podcast is Dr. America. It's available on iTunes or wherever you guys get podcasts. And the material covers a whole wide range of health policies, but then we also talk about policies that at first glance might not seem very health-oriented or medical, but then you look a little bit closer and they actually have serious health consequences. Things like minimum wage, housing, homelessness, gender equity. So we cover a lot of different materials, but it always comes back to the health and well-being of our country.
Dr. Sanjeev Sriram.
Yeah.
It was a pleasure speaking to you. It was my honor speaking to you because
thank
you do great work.
Thank you. Pleasure is mutual.
Effective when I get back to Houston, your podcast will be displayed on my website as well.
Greatly appreciate that.
Thank you so much. And thank you so kindly for giving the interview.
Thank you.